Hi, my name is Sue, and I am here to check your blood sugar by finger stick. Is this a good time for you?
Yes.
Can you give me your name and date of birth? All right, and that is the person I have an order for to do this test. Have you been checking your blood sugars at home?
No.
Okay, so this is kind of a new procedure to you.
Mm-hmm.
Well, we're just going to lightly prick your finger and put a little bit of blood on the meter, and it will tell me how you are doing with your blood sugars. Okay, gather my equipment. All right, do you want to wash your hands?
Sure.
And I'll wash my hands. Okay, so I have my test strips and my meter. And I should have a lancet in here. There's my lancet. Set this off to the side and we'll get started. Okay, I want to assess your fingers and see which would be a good site. Side of a finger is better than just the end of the finger because that's the ones you feel with. Do you have a special finger you would prefer?
Nope.
Doesn't matter. So if I went here on this side, it would be okay?
Yep.
All right. Let's go ahead and clean that site so that it can get drying. Okay. And I'm going to go ahead and choose a test strip. I'm going to put it in my machine. This activates the machine. And it says code 25, and we are code 25, and it's ready for a drop of blood. And I checked the expiration date to make sure we were good. All right, so we are clean, we are dry. I'm going to gently place this against your skin, and there's going to be a poke. And we'll throw that in the sharps. I'm going to wipe away that first drop of blood. $103, not bad. Would you like a Band-Aid for that?
Yes, please.
Okay. These Band-Aids are old. They are. There you are, ma'am.
Thank you.
Thank you. You have a great day.
You too.
I will record this and make sure that your doctor knows what it was.
Okay.
All right.
Here you go. I have my stool sample for you.
All right. Thank you. Okay. You would need to explain to your patient how to collect the stool sample. The stool sample cannot be mixed with urine or toilet paper. And they can put it in a specimen cup and bring it to the lab, and the lab can go ahead and develop it for them. Obviously, I'm going to put gloves on. There are several different kinds of slides available. The slides that we have are from Occult, and they need a developer. There is another one that is out there that is called Hemoprompt, It does not need developer because the developer is built into the back. And when you pull this strip out, it applies the developer, but they're pretty much the same thing. They operate pretty much the same. Always read your directions that are on your card to know how to do this correctly. The first thing I'm going to do is I'm going to open my card, and I have 2 areas to place the stool. You want to get stool from 2 different areas and 2 different ends of your applicator. So I will get some stool. And I will apply it to the first area. And now I'm going to flip my stick over to the other side. And I'm going to find another area that is clean. Get a different area of stool and apply it to the sample. Okay, and at this point you can go ahead and throw this away. Don't have a wastebasket. Sometimes these cards are mailed back to the physician's office, so there's not a sequence of how quick you have to put the developer on. There is a sequence of how long you need to leave the developer on to read it. So let's go ahead and close this up and read our directions on the back. It says that you should put 2 drops of developer on each stool and 1 drop on the control. Then you have to wait 30 to 60 seconds. So 2 drops on the first one, 2 drops on the second one, and 1 drop on the control. And as you can see, the control immediately starts to turn blue. So I know this card is appropriate, and I'll start the timer, and I will wait for a full 60 seconds before I declare it negative. Now, if it starts turning blue right away and I have a positive, the test is over and I can write the positive down. But before I say it is a negative sample, I want to wait the full 60 seconds. And after 60 seconds, we see that just the area on the edge is starting to turn a little bit blue. It's very faint, but this is a positive stool. We would go ahead and dispose of our sample in the wastebasket, clean our area up. We can give our results to either the doctor, the patient, and definitely we want to document it. The stool sample can just be flushed into the stool. We're not going to save this and reuse it, okay? Hi, my name is Sue, and they sent me down to the lab because I'm supposed to give a urine sample.
Okay, let me tell you how to do it first.
Okay.
I'm going to have you clean one side of your labia with this, the first one. I'm going to have you clean the other side of your labia with the second one. And then I want you to use the third one to clean from the front all the way to the back.
Okay.
Okay. And then you are going to start your stream. We're going to do a midstream clean catch.
Okay.
So I want you to take the lid off, put the lid upside down so that way it's sitting on the top here. Do not touch the inside of that cup. Try not to touch the cup to your skin, so that way we try to keep it as clean as possible.
Okay.
So you're going to start your stream. You're going to go just a tiny bit, and then I want you to put the cup underneath it and catch the rest of the urine.
All right.
Any questions?
No, I think I can handle that.
Okay.
Thank you. I'll be right back.
Now, if it was for a male, you would also instruct them to use all three of the wipes too, to clean the penis off, the tip of the penis, and to go all the way around it.
Here's my urine sample.
Thank you. And I'll get the results to your doctor.
Okay, thank you.
So I'm going to put my gloves on. There's lots of different urinalysis test strips that we can use. Some of the bottles go like this. Some of the bottles go like this. So you'll just have to look at your facility as to which type of bottle they have. On the side, it tells you everything that we're looking for and what time you need to test it. So it's important that you have a watch or a clock or a phone with a timer that you can do it, because these should all be read at specific times. For example, glucose is read at 30 seconds. The last one is not read until 2 minutes. The other important thing when you use your strip is you want to make sure you keep it flat. However you hold it, it can't be held like this or like this, because if you do, it will bleed down and contaminate your specimen. So as soon as you dip this in, your time starts immediately. So we're going to take the lid off. Remember, make sure you hold the lid upside down. You're going to put it in and make sure you get all of the strips covered. You're going to tap it and you're going to start your time. You're going to read from the bottom of the strip up. Just like on this, you're going to start at the bottom and work your way up. Try not to touch the bottle with your strip. So glucose is negative. Bilirubin is negative. Ketones are a small amount. Specific gravity is 1.20. Trace blood, pH is 5.0. Protein is small. Urobilinogen is negative, or 0.2. Nitrates are negative. And now you wait for a whole nother minute to read your last one. And we'll just pretend now it's 2 minutes and the leukocytes are also negative. So then you're going to want to record all of your results and make sure you notify your provider. Document everything. Make sure you document what your urine looks like. So this one's kind of an amber color and maybe a tiny bit cloudy. And that is how you do a urinalysis. Make sure you save your urine until you know if they want to order a culture, because this person has blood, so they may want to order a culture to see if there's any bacteria. Never throw it away until you're completely sure you're done with it. Make sure it's labeled with the patient's name, the date, the time, and then store it however your facility recommends it.